Hello everyone, my name is Ajay Nigde and today I am going to demonstrate to you Dr. Tech Buddy application for hospital management. We provide the hospital management solution. So basically this is our login page and this is contact us page where you can find contact detail. So now I am logging into the application. This is my username and I am entering my password. Here we can see the multiple hospital list of multiple hospitals where you can select your hospital. So I'm selecting one and first hospital, that is hospital A, and if I click on the submit I'm logging into this page. So basically this is the dashboard where you can find today's appointment, today's check patient, today's remaining patient out of the check patient, out of the appointments, and today's patient total medicines, number of medicines that you have added, and your staff. So this is the appointment page where you can book the patient appointment here. So now I am searching the patient name by name. So if I put here Ajay, I will get all the patient with name with Ajay, like Harshada, Ajay, Nigre, everything. So I'm selecting this. So you can see here pop-up patient added to waiting list successfully. So I'm taking another appointment like by the phone number. So if I enter this phone number I will get these many contacts. So I'm selecting this contact. So we can see here today I have taken these 4 appointments for Dr. Akhte. I can select the other doctor as well. This is Dr. Swapnil, and if I search any with mobile number, so if I select this patient, and we can see here the appointment for multiple doctors. So we can sort sort this list by the Dr. Akhte. We can sort Dr. Swapnil. So we can sort this list by the doctor as well. You can search the patient name by the name as well. So again I'm going to the navigating to the dashboard. We can see here today's appointment is 5. Today checked patient is 0 because we have not yet checked any patient. Remaining patient is 5. Total patient is 2,06,000 and whatever it is, and total medicine counts is this and user is this again. So now this patient is come and uh, he's going to inside to see the doctor. So now we are clicking on checkup. We are taking his weight like 56 kg, 88, 95. We are entering this pulse rate like whatever it is. Temperature is 99, SpO2 97. If I click on the submit button, so we can see here this is the green part, that means he is going to inside. So if I click on this checkup list, so basically doctor is on this window and receptionist is taking your staff is taking all the appointments from this doctor, from this today's appointment page. So this checkup list is not visible to your staff, so we have provided role-based access for this application. Later we will discuss on that as well. So basically in the doctor list, if we refresh and we can see here, uh, if we refresh and we can see here, this the patient is in green. The patient is in green, which is recently come to inside. So we don't need to search the patient name here. We can directly check the patient name and we can directly click on the checkup. So this is the checkup basically page where we will get this patient name and this age by the by his birth date and his mobile number, everything, his medical history. He first time he came at 2020, then 2020, 2024. We can check one by one history here. Here we can check like medicine 1 2 3 4, and we will give you, and we can check here full history as well. If you click on the full history, you will get all the full history here. So basically, so if we check this patient and we found that he have fever, so we have added this fever diagnosis here, and if we added remark as take a rest or anything. So, and if we have already saved this fever prescription, suppose we have added already 5 or 10 prescriptions for fever, so we can search those prescription from here. So if I click on the here, so I have one prescription added here. Okay, so I can select this prescription, or I can simply delete it from here if you want to delete prescription from the fever list. So now I'm changing this to cold. Now I'm changing this to cough, COUGH. If I change this to cough, we can see here one more prescription is there for cough. So I can select this. So basically this is the medicine names, but this is a dummy data that I have added. So that's why it is showing like this. This is not actually medicine name, but this is dummy data we can see here. So this might be paracetamol. So I want to edit this prescription because this prescription might be for the person who have 20 years old and this person is 50 years old. So I don't want to give this tablet here. So I can delete this prescription and I can add one more tablet. Suppose paracetamol is not added. Maybe suppose I have added anything. Suppose this is the medicines. This is all the dummy data that we have already 5,000 medicines we have added. It's come from there. So this is the dummy data. We can add this medicine name here. I am adding this dosage power like 200 mg, and I'm adding his after the breakfast, after the dinner, for 4 days. If I have added 4 days, so I can add here add medicine. So we can see here the medicine will be added in this list. So if I want to add any instruction, we can add it here, like suppose this liquid if I have added, and if I am adding this, if I adding this medicine name, this dosage is this, and this before lunch and dinner, days is 3, and instruction is like take with milk, take with milk. And if I add the medicine here, we can add here 5th medicine as well. The instruction we can see here. So this is the prescription. So this is the cough is already there, but if you want to save this prescription, you can click here, just only click, you just click here and submit the button. So if you submit the button, it will automatically add it into your cough prescription list. Suppose you have already 5 prescription in the cough, and if you save prescription it again, then this is the 6th prescription that you are adding into the cough list. So currently I'm not saving this prescription. So you can set here is the bill, like whatever it is, for 200, 500. You can check here page size for the print prescription. Orientation is portrait or landscape. You can add here. If you uncheck this print button, yeah, then you can only if you want to only submit and you don't want to print, just uncheck this print button and submit it. But I want to print it, so now I'm submitting this. If I submit, if patient data is submitted, then you can see here this pop-up, the patient data checkup is done and patient data submitted successfully. You can close this. You can close it by here. You can close it by here, and we can check here. So for this prescription, this is the prescription that we have 5 medicine we have added. This is the instruction take with milk and everything. It is here. Ram Hospital, everything you are getting it here with mobile number, address, is everything you will get here. So basically this is the prescription that you have. You can print it here directly from here. Okay, so now I'm closing this prescription and we can see other checkup list. So other checkup list. So if you want to, if patient directly comes to the doctor and he had not taken any appointment. So basically here we can see the 4 patients are remaining from the checkup. So if I'm go to the dashboard, here we can see today's appointment is 5 total appointment is 5, and today check patient is, recently we have checked 1 patient, remaining is 4 patient we can see here. Now I'm coming to checkup list. Suppose is if it is there any patient which have not taken appointment, we have not taken he had not taken any appointment and directly comes to the doctor, so that doctor also can check the patient. If doctor want to add new patient, you can simply click here to new patient, and he can add all the information here like first name, middle name, last name, date of birth and mobile number. So he can add all the patient detail here, and he can add the patient here. So now again, so we have, suppose the patient is already registered, so that we can search, doctor can search here the patient name. Suppose doctor search patient name here. Doctor get all the list with the patient name, and doctor can search by mobile number as well. So if I click on the checkup, so now we are here to checkup page. So doctor can see here all the history here, all the history, full history. If you want to see the history from one by one, so he can see only the history with this date. And if doctor want to see full history, so doctor can see full history from here. So you will get all the records from past 15 years, 10 years, whatever it is. You will get all the records from past 10 years. So doctor can see check the patient. He can add all the details and submit button or expert here. Also let's try it once. Suppose weight is 50. I don't no need to add other details. So diagnosis is fever, and if I search it here, I can select this. I can select this prescription, and I can, suppose doctor want to preview this, so doctor can simply click on the preview, and doctor can see this preview as well. So which we missed in the last checkup. So we can print it from here as well, directly print it from here as well. So if I click on submit button, patient data submitted successfully. If I close it, this is download and secure file. So if I close it, if I click on this close button, doctor can navigate to this checkup list. So doctor can remove this patient from checkup list as well. Suppose I want to remove this patient, so I can remove it from here. Patient is removed. We can see appointment, only 3 patient is there. If staff is send any patient to checkup, if he add this information, suppose if he add this information, if he click on the submit, doctor can see the patient is in green, which is which doctor can check this patient. So in the appointment we can, you can change this appointment count numbers as well, 1 to 2, 2 to 2, 3, and he can delete as well. Staff can delete this as well. So from here, if suppose if new patient is come and patient is not already registered and patient come first time, so we can directly add new patient from here. We can add all the information like first name, middle name, last name, mobile number, date, gender, PAN card, Aadhaar card, everything you can add. If you want to add, this is not mandatory fields, but you can add first name at least, and mobile number and date of birth should be is the mandatory fields, so that you should add those fields here when you add the patient. So you can add patient here as well. If you want to see the patient list, you can see it here. So you can see here where you can search patient from here as well. If you want to add new patient, you can simply click on new and simply you can add patient from here as well. So this is the staff detail. So doctor and admin can you add the staff and manage the staff detail. So there are lots of 3 to 4 10 to 11 staff are there in the hospital, so you can add, or doctor or admin can add new user. If you click on the new user, you can add this user. Suppose Nitin first name, middle name Sachin, and last name is, let's say, Patel. Username is Nitin123. So this username is required to log in. So to log in, you can use this username, not other fields. You can none of the other fields you can use for the login. You should use only this Nitin, this username to log in. Suppose I am adding here mobile number 1 2 3 4 5 6 7 8 9 10 character. You can select these many roles: accountant, admin, doctor, guest doctor, manager, nurse, pharmacist, and receptionist. So if this Nathan is doctor, you can add his role. If it is a guest doctor, you can add this. So every role have different access, and you can see different menus for every role and different access. Suppose if I add admin and doctor, so those admin and doctor can add the user, but receptionist can't do it. Receptionist can't see reports even. Receptionist can't see billings reports even. She can't add medicines. So the pharmacist can add medicines. The nurse can add medicine, but receptionist can't. So every roles have different access. So if you want to make this Nitin as admin, you can select this here, admin. You can add here Nitin@gmail.com, his mail ID, his password. Let's say Nitin12345. This is a password I have added. Degree, let's say MBA. For admin, it's MBA. And if I submit button, the user has added successfully. We can see here where we can see here Nitin, where it is. Here we can see Nitin. This user is added Nitin. So suppose if I want to delete this, edit or delete this user detail, I can simply details. We can edit it here, password, everything we can delete. You can update it or you can simply delete. If I click on delete, the user deleted successfully. See here, user deleted successfully. You can see user information here. So this is the user information that we can, staff information that we can save it here. So this is the billing details, where we can see the billing by date wise. We can take a statement of, if you want to create a new bill, simply select a patient from here. If I select here Ajay Singh Day, we can see here expense name. Just add expense name like medicine medicine 1, and the amount is 500. You can submit it here. Another is injection REM 100, something like that, 1000 rupees. Submit, then checkup. Something like lab test. You can submit it here, and you can print it from here. If you print it here, you will get the, you can print it here. You can see here the billing, all the bills you can see, and you can print it here. So basically this is the billing tab, and this is the report tab, where you can, by default, you can see today's waiting list, today checkup report, today checkup patients. So 2 patients we have checked till now, so you can see here bill and total bill. You can export it here. If you want to see the previous report, like from the 2 previous report, you can check it from like 2011 1st Feb 2011 to Feb to we can, if we want to check 12 Feb 2011, if I click on submit, you will get all the details for this 12 days. So we have in those 12 days, if we see here, around 2500 patients that we have checked, and this is the amount detail. Here we are getting not getting correct information, but we'll fix that, and we'll see here correct detail like first name, last name, middle name, everything. We will get the correct detail. We can export it, we can print it, those details. So this is the checkup. Again here billing report as well. Yeah, this is the basic overview of our Dr. Tech Buddy application. So basically we are providing here online solution. So this application you can use by your mobile, you can use by tab, or you can use by laptop. So basically online solution, so from anywhere you can access this. So no limitations for user, nothing. So already we have added around 2 lakh patients, and we are testing with the 27 lakhs of prescription data. So it's a huge data, so, and it's working properly. So performance wise, it's absolutely like fine. So now I'm logging out to the application. Now we are into login page, and you can simply contact us by contact us page. You will get all the contact details from here. Okay, now that's it from my side. That's it from my side. Thanks for watching this.